Please listen carefully and write down notes, as this is an instructional video on taking skin fold measurements and calculating body fat percentages. First, remember all measurements will be taken on the right side of a client's body. Make sure the client's skin is dry and lotion free. Do not take skin fold measurements immediately after an exercise. We first want to identify all landmarks and sites before measuring. When measuring, you're going to want to firmly grasp the skin fold. That is 2 layers of skin and subcutaneous fat between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. To grasp the skin fold, place the thumb and index finger about 3 inches apart on the line perpendicular to the long axis of the skin fold. Pull the skin fold up and away from the body. Keep the fold elevated while you take the measurement. Keep pinching the fold with your left hand throughout the entire process of the measurement. Hold the caliper in your right hand with the dial facing up and towards you to get an accurate measurement. Place the jaws of the caliper perpendicular to the fold, 1 centimeter below the fingers and halfway between the crest and the base of the fold. Once reading is taken, release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. Record the skin fold measurement to its nearest 0.5 millimeter, 1 to 2 seconds after releasing the scissor grip. Take skin fold measurements in rotational order to allow time for skin fold to regain its normal thickness and decrease any pressure or pain given. Take a minimum of 2 measurements at each site. If duplicate measurements are not within 1 to 2 millimeters, you must wait and retest the site. Once done, calculate the average for each skin fold site. Using the client's measurements and validated skin fold equations, percentage body fat can be estimated at the end. Using the skin fold calipers. First, on the tricep, we'll be using a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the Alcaron process. Then we'll be taking the subscapular fold. This is a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. The third is the chest. It's a diagonal fold, 1/2 the distance of the anterior axillary line and the nipple. That is for men. For women, it would be 1/3 the distance of the anterior axillary line. For the mid-axillary, the vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum and across. We then will be taking an abdominal measurement, which is a vertical fold, 2 centimeters to the right side of the umbilicus. We then will be taking a suprailiac measurement. This is a diagonal fold in line with the natural angle of the iliac crest, taking in the interior axillary line immediately superior to the iliac crest. Finally, a thigh measurement, which is a vertical fold on the interior midline of the thigh, midway between the proximal border of the patella and the hip. These are the sites and the measurements for men and women formulas. Our subject, female, This are her measurements and calculations. These are the equations, the Brozak equation and the Siri equation. These are my references. Thank you for listening in.